Welcome to this presentation about malignancy and artificial intelligence diagnosis in the skin cancer. How far are we? Nowadays, we have to understand that artificial intelligence in sonography is going to be like kind of pyramid in which in the lower aspect we are quite developed. For example, that the automatic adjustment of parameters such gain, depth, frequency. Most machines are just doing that for us. And then with just pushing a button. Then the next step would be the automatic lesion detection. That automatic lesion detection, it takes more artificial intelligence. That is what we call segmentation. From one image, just taking one part of it and discard the rest. And the next step would be the assisted ultrasound diagnosis of skin lesions. That would be supervised learning or supervised learning, machine learning, in which the machine can tell us what kind of lesions we are dealing with. Is benign, or malignant, or even the exact diagnosis of this skin lesion. And finally, the automatic prognosis, what has been called the machine learning with reinforced learning, that would be what we are calling radiomics. Then with the image, the machine is going to tell us about the prognosis of this lesion in concrete. Then by now we are this basal classical computational step is just done. The automatic lesion detection is just done, and we are now dealing with this problem, that is the diagnosis of the assisted ultrasound diagnosis of skin lesions. With more times, we will reach the automatic US prognosis, and that what we have been calling radiomics of the skin lesions in ultrasonography. To address this problem, we created or were trained, better than created, because the algorithm we were working with is a previously created algorithm adjusted for our data set, but we call XBot in honor of our beloved Jimena Borsman. That's the reason why we call it with lots of sympathy, XBot. What we wanted to know is if an algorithm could differentiate between benign or malignant. Then this lesion here is benign or malignant, this lesion here is benign or malignant. Well, from the human point of view, maybe because of the features of this image, this bad delimitation, this interlesional flow that we can find in this lesion, we can think that this is malignant lesion and this is benign lesion, despite there's some vascularization in the peripheral area. But is an algorithm able to differentiate benign or malignant skin lesions in ultrasonography? We train a pre-trained neural network that's called Efficient Net B4 with the multi-label mode, and this Efficient Net had been previously trained with a big amount of images, is what we call ImageNet. The basic features are already trained, and with 234 images of Doppler in 7 categories of tumors that you see here, that more or less represent what we find usually in our everyday consultation in dermatologic ultrasound. Most of them are cysts, basal cell carcinoma, lipomas. There are benign or malignant. As you see, this, for example, cyst is benign, and BCC, basal cell carcinoma, is malignant. More or less, this is what a representation of what we usually see in everyday consultation. Then we wanted to train our artificial intelligence to differentiate between benign or malignant with new lesions. Then Here you can see that it's malignant or benign, and what we got, the training we got, was that the differentiation of benign or malignant reached a sensitivity of 80%, zero point 0.8, and specificity of 0.6%, and positive predictive value of zero point 0.8 and a negative predictive value of zero point 0.6. Then the machine was quite good when in training, when we trained the machine to differentiate between malignant and benign lesions. But as you know, we have to confront it with new data. And this new data, we offered the possibility also with new data to compare the ability of our artificial intelligence with an expert human, then with 35 new images. And what we found is that the algorithm could differentiate 73% with a sensitivity of 73.3% with this specificity, and high negative predictive value for malignancy discrimination, with the precision of both the categories, malignant and benign, that's with of about 77%, against a 73%, 75% of specificity, and this negative and positive predictive value with a precision of 74. Quite similar, as you know, there's not much difference, and statistically there's no difference between these results. Then, with this, we can conclude that we can train artificial intelligence to differentiate skin lesions in ultrasonography, or at least to help us to differentiate by benign from malignant, at least at the level of an expert. This expert was a human dermatologist with almost 6 years of experience in dermatological ultrasound, everyday dermatological ultrasound. And does it mean that we are going to replace the human dermatologist with this kind of artificial intelligence? No, I think we should understand, or we should take it as a possibility of making benefit of this artificial intelligence to get better diagnosis, and to assist us with diagnosis in case that we are doubtful. The assistance of this kind of intelligence could make us more reserve our diagnosis. Then, what is going to be the role of the dermatologist in the future? Mainly, we will help to design the algorithms. We will help or the training of the algorithm. The training, we will train the machines with our cases, and we will also have to supervise algorithms because there will be errors, and these errors have to be minimized, and only with help and knowing why the machine has gone wrong, and this is something that only the human by now can do. We are going to make this kind of technology more accurate to help us to make better diagnosis. As a conclusion, artificial intelligence is a field of development, also as you've seen in dermatological ultrasound. Artificial intelligence aided diagnosis is feasible and with up-to-date algorithms and data sets. That is very important. Both things are important. And that the role of the physician in skin ultrasound is going to be deeply influenced by artificial intelligence in the next future. Thank you very much for your attention.